When I went back to PA school, I didn't want to stay in sports medicine because that's what I had always done and what I'd always known. And so for my elective rotations, I wanted to take the biggest departure I could from my comfort zone and what had been home to me for the last 6 years of practice. And so I decided, well, maybe I'll do a rotation in bone marrow transplant. They actually reminded me of my athletes too, because they have very similar motivations. Now, athletes, they just want to return to their sport, which is the most important thing to them. But cancer patients have a whole different kind of motivation in that they want to get better, but the stakes are much higher. In order to make them feel comfortable, they need to feel like they have some sense of control. And I feel like control comes from being able to ultimately understand their disease process. I really just try to explain as much as I can about the process, about what they can expect. Then they could be impatient, like, oh, well, Staci told me that was going to happen, or she told me it might happen, and then they're not surprised because cancer was already enough of a surprise. They don't need more. When I was growing up in rural Illinois, if somebody went to Iowa, you knew what that meant. It wasn't going to the state of Iowa, it was going to the University of Iowa. And that's where everybody from home went for their specialty care if they needed more complex kind of treatment plans. So it was important for me to work at an institution that could provide good care and where I could be taught how to do it as well.